Welcome to the show. My name is Niraj Nanal, and we will be discussing REBT and mental health on this channel. And today's topic, which I have in mind, is common objections against REBT answered. Because last podcast we asked the guest to give his version of some of the limitation of critique of REBT, which he did, Dr. Marty Nemko. Now today we will try to raise the common objections about REBT, that is rational emotive behavior therapy, and get answers from the expert. And I'm really happy to welcome Dr. Michael Edelstein, who is a student of Dr. Albert Ellis and who has experience of doing REBT for 40 years. So that qualifies him as an expert. Welcome back. Michael was once on our show earlier also. So, well, thank you very much, Michael, for coming on the show and sparing the time.
Yeah. Thanks for inviting me, Niraj. And just another word about Albert Ellis. He started a revolution in psychotherapy, and he dramatically changed the psychotherapy movement from more psychoanalytic therapy, which was based on the Freudian model of talking about your childhood, and I'm just trying to put in my, I guess it's the wrong place. Oh, okay. And he's written over 80 books on psychotherapy, Albert Ellis, Ellis. And as you said, Niraj, I was a student of his many years ago. And I've been practicing rational emotive behavior therapy, which has its basic premise that our emotions come from are thinking about situations, not situations themselves. And that's a very powerful idea, because if you don't like your emotions, then look to your thinking and you can change your thinking and thereby change your emotions. And you would look for the kind of thinking that causes undisturbed emotions, such as anxiety, depression, and anger. And those are in the form of demands: must, should, supposed tos, and have tos. I must do well, you must treat me well, and life must go well. So that's the basic premise of REBT, which I practice. I also have a book called 3-Minute Therapy, which describes REBT, and a website, 3minutetherapy.com. And I do therapy internationally on Zoom, FaceTime, phone, and Skype. So if you're interested in the session, go to my website and you get contact information from me, 3minutetherapy.com. Niraj, were you going to say something?
Yeah. So, great. So, it will be an interesting discussion. So, shall I start with the common objections
Yes,
against REBT? Yeah. So, you said you explained a model in brief. And the first objection which comes to mind is that the theory of REBT is too simplistic, that your thinking creates your emotions, and it gives a very easy explanation of the complex mental processes. It does not consider factors like culture, upbringing, genes, the unconscious. So how do you answer this objection?
Yes, that is a common objection. And the answer is, it doesn't dismiss culture, upbringing, and genes in terms of adult personality, but it does see them as influences, not immediate causes. So there are distal causes and ultimate causes, and these are immediate causes, but the thinking is the immediate causes. But there are factors that influence our thinking. If we're sick, our thinking isn't as reasonable normally as when we're healthy. If we're haven't gotten much sleep and we're tired, that tends to cloud our thinking. So there are these influences, but REBT looks at the immediate cause and acts on the immediate cause, which is our thinking, and shows you how to change our thinking. So differentiate between influences and immediate causes.
Yeah. Very good, very good. So now the issue is you explained the first part, but what about the notion which Freud advocated, that your thinking is just one part of your being, consciousness. You are a complex being with the layers of unconscious and hidden desires, and all these things also contribute to your emotions. And unless and until you go deep into the nature of your problem by looking at your childhood, by looking at your past influences, only looking at thinking will be too superficial. So that is another objection which is against REBT.
Yeah. Well, again, if the main premise is accurate, our thinking causes our emotions, then those other things are influences. Now, for the person who objects on the grounds you just mentioned, Raj, they would have a tough time explaining why REBT and other cognitive behavior therapies, which is also based on the idea that our emotions come from our thinking, has been so successful over the last 50 years. And it's pretty much taken over the kind of therapy that most therapists do. Most therapists are types of CBT therapists or are influenced by CBT in their therapy. So, so if this wasn't a major factor, then REBT and CBT, cognitive behavior therapy, would not have been nearly as successful and nearly as popular as it has been.
The logic which you gave seems to be not reasonable to me, because once upon a time, Freudian psychoanalysis was also popular. That does not make it right.
Right, it does
So,
not make it right, but it does make it the best game in the house. And at that time, there was not much competition for Freudian psychoanalysis. But as competition arose, such as Adlerian therapy and Hornian therapy and behavior therapy, which was an early cognitive behavior therapy, as those arose, and then there was competition with psychoanalysis, then the more helpful one won out, because people wanted to use their time and money efficiently, and they found CBT and REBT was the most efficient way to do it.
great, great. So shall I move to the next question?
Yeah, yeah.
Yeah. So next objection against REBT is it is too directive. In the earlier tradition, the common notion which we have seen in films and in general idea people have about a psychotherapy session is a therapist is very empathetic, and listens to you, and he understands your emotions, and he does not interrupt you, things like that. In fact, the Carl Rogers, who talked about active listening and helping clients to shell out his problems and become a good listener. In opposition to that, REBT is more directive. It is more direct, and there are no um, qualms about interrupting the client and directly going to the root of the problem, things like that. So how do you answer this objection that REBT is too directive?
Well, yeah, at least two objections in there. One is that REBT doesn't mind interrupting clients, and that's really not the case. There's nothing in REBT that recommends interrupting clients. So we do let clients speak and try to understand and what they're going through, and especially empathize what they're going through. Because one of the things we do in our directive therapy is sometimes suggest irrational beliefs that the client might have. And that involves empathizing with the client and putting yourself in the client's shoes. And if you were that person and you had anxiety, what you might be telling yourself. So empathy really is an important part of it. It's just not really highlighted that much. And also in terms of the directive nature, consider a mathematics teacher who isn't directive with the students in teaching algebra and lets the students fiddle around and come up with their own solutions and just listen and things like that. That would not be very efficient. And since in REBT we teach a method that people can use, and the method being identifying your musts and shoulds, questioning, challenging, and contradicting the musts and shoulds. Since we're teaching a method, that's a more efficient way to do it than just listen and empathize and wait till the client comes up with the right answer. So, so that's one of the responses to that. And also, it saves time, it saves money to teach the clients a method. So think of REBT more as an educational model rather than a therapy model. So you were pretty much expressing a therapy model. Listen, empathy, talk about the person's childhood. But an educational model means teaching people basic ideas, basic premises, basic methods, those kinds of things. So we follow the educational model.
Great, great. I think that would have answered many people's objection also about this particular aspect of REBT. Now, I want to move further and ask you about the most common objection which is raised about REBT since its start, since its beginning. And that is REBT is too intellectual, it is easy to understand but difficult to implement. It is theoretical. It is very difficult to implement what REBT proposes. So you can understand the concept easily, but if you start to implement that, then it is a very difficult job. It doesn't get implemented easily.
Okay, you had two objections there. One is it's intellectual and the other it's difficult to implement or practice. So in terms of the two intellectual, REBT and other cognitive behavior therapies are based on the idea that our emotions come from our thinking. So if what you mean by intellectual, you mean too focused on thinking, well, that's really the bottom line, where our emotions come from. So it's if REBT is intellectual in that sense, that's a good thing, that's a positive thing, because that's the most efficient way to help people with their problems, to help them identify their irrational, unreasonable thinking and help them change that. Now, in terms of difficult to practice, we teach a method. Some people call it the ABC method. I call it the 3-minute exercise, where you outline the A, B, C, D, E, and F of a problem, where A is the activating event, say I was criticized. B is the irrational belief, I must be approved of, I'm a loser. C is what the irrational belief leads to, the undesirable emotion, which in this case could be hurt. And then it goes on to D, E, and F to change the thinking. D is disputing or questioning the thinking. What is the evidence? I'm a loser because I was criticized. And E is there's no evidence I'm a loser. There's evidence I'm an imperfect human who acts imperfectly, not a total loser. And once you internalize that thinking, then at F, then that would help dissipate your feelings of hurt or depression and lead to appropriate adaptive negative emotions such as concern, disappointment, frustration, and lead to trying to change the situation if change is possible. So that's really not difficult at all. Once clients learn that, often in the first or second session, then they can practice this and teach them and become their own therapists, diagnose the problem with the A, B, and C, and then work on the problem with the D, E, and F.
Okay. Then if it is not working for some people, What is the reason for that? Just explaining that they are not practicing enough? How can you make effective use to basically institute change in a person's life through REBT?
Yeah, if it's, yeah, I agree with the answer you mentioned in there. And that if it's not working, usually it's because the client isn't working at it, isn't practicing the 3-minute exercises. It's just like if you're teaching another language, say you're teaching French, and the person, it's not working, the person isn't learning French, the usual reason is they're not practicing it. Anyone can learn another language at some level, not become fluent in another language, but at least learn another language at some level if they practice it. And it's the same with this. Again, we're working with an educational model, so the main principles are the same.
Yeah, great, great. That makes sense. Now, I am moving forward to another question, and this is regarding the overall psychology movement from Freud, then Ellis and Beck, and then the recent phenomena of the third wave therapies, as they call it. Um, so here, the notion which is normally raised is that in psychotherapy, in general, psychotherapy are very problem focused. In what I mean by that is REBT is pinpointing the problem and focus into relieve the problem. But instead of that, accepting the problem and moving towards meaningful goals, like the stream of positive psychology, which talks about that, or ACT, acceptance and commitment therapy. So the approach of REBT is too problem oriented. So what do you think about this argument, as well as the new notion that you have to move away from the problems and look at what do you want? What do you want? What is the meaning of where you will find meaning in life, where you will find constructive goals in life. And once you start moving towards that, the problem disappears instead of just focusing on the problem. So the bottom line of the question is, REBT is too problem focused.
Yeah, I think that's a misunderstanding of REBT, because the first step in REBT and the last step is teaching acceptance, accepting yourself, accepting that you have a problem, recognizing this is a reality, and then moving toward what can you do about it. And REBT is very directive in terms of what you can do about it. As I mentioned, in terms of questioning, challenging, and contradicting your irrational beliefs, and to establish goals in your life. In order to have an enjoyable life, it means having goals and having a passion and working toward those goals and working toward the passion. And that is more likely to lead to an enjoyable life than not. So those are the goals, and the first step is acceptance, accepting yourself and accepting the fact this is a problem.
Okay. So I think that was a very good explanation about this particular issue which is raised. Now I want to move to the next question, which is regarding some technical aspect of psychotherapy, and that is resistance in clients. So what I mean by that is that, let's say a person has an anxiety problem and he has some magical notion that somehow this anxiety is protecting him from the things which he is fearing. Okay. Now, psychotherapy talks about this as resistance, I assume. And people like David Burns, who popularized cognitive therapy after Ellis and Beck, started a new therapy discipline where he focuses on melting that resistance. So I want a specific answer, if you can, that what Ellis said or what REBT says about the whole concept of client resistance, and what is the solution given by Ellis on this.
Well, I don't see the problem, because when people come to therapy, they're spending their time and their money. So it's highly unlikely that they're going to resist what they're spending time and money on. It's like saying you're selling your book and I give you money for the book, and I say, well, I'm not going to read the book after you give me the book. So that would be resistance. But normally that doesn't happen. And in my over 40 years of doing therapy, I don't recall anyone resisting. People are very happy. People that I see are very happy to be in therapy. They're very happy to have a clear way to work on their problems, and they don't have an interest in resisting. So it just seems like a contradiction in terms that someone comes for help with a problem, whether it's an emotional problem or any other kind of problem, and then they resist the help. Why did they come in the first place if they're going to resist the help?
Yeah, but I think two points here which I would like to add. One is people are complex and sometimes paradoxical. So even though they are coming for the therapy, so they want help with the problem, but at the same time, they think that this anxiety, if we consider anxiety as a problem, that this anxiety is protecting it. I think Ellis has written one book on resistance also. So what I wanted to ask you is, what is REBT's view on this concept of client resistance? Because many therapists, since Freud and other therapists also recognize this phenomena in client. So you are totally rejecting this phenomena of resistance?
Yeah, I'm totally rejecting it. And you said Ellis wrote a book on this? I wasn't aware of that. What's the title of the book?
I think overcoming resistance.
Oh, yeah, I'll take a look at that. Thank you
Mm,
for
yeah,
mentioning that,
yeah, yeah,
Niraj.
yeah.
Now, you could, with a stretch, you could interpret procrastination as resistance. Is that the idea? That that we REBT therapists suggest homework assignments that people can do that I mentioned earlier, the A, B, C, D, E, F, write out that on your problem and practice that on a regular basis. And some people do procrastinate on doing that. So is that what you mean by resistance?
No, so let me explain you this by giving you an example. So parents of teenage children, hmm, sometimes when their son or daughter is not back till midnight, hmm, they start worrying,
Yeah,
and they
yeah,
think that if I worry enough,
yeah,
okay, then nothing, no harm will happen to my children. That is one
yeah,
example.
right. Yeah,
Another example is somebody has been mugged
yeah,
and he thinks that his fear is protecting him from
yeah,
future such incidents. So he clings to his anxiety, even though
right.
at one level he wants to let go of it.
Yeah. I
So
agree with
this
that,
is,
but yeah, I'm
yeah,
sorry.
so this is the concept of resistance, which the way I see it. And I wanted to know what is the take of REBT. Does REBT consider this phenomena?
Well, let's take the examples you gave. If I worry enough when my son or daughter didn't come home by a certain time, that'll protect them. Well, in that case, they wouldn't come for therapy unless their problem in therapy was, I'm not worrying enough, and so I'm not going to protect them enough. But that's highly unlikely. So I'm not clear why this is a case for therapy. Why would someone uh, have a problem if they're worrying?
No, so let me put it in a different way.
Yeah,
So let's take an example of person who has been mugged and he who feels constantly anxious.
yeah,
Okay.
yeah,
So there are two contradictory notions going through his mind. At one level, he understands that this his worrying is futile. Okay.
yeah,
That but at another level, he has a belief that somehow this worry is protecting him. So even though he understands it intellectually, he's not able to let go of that worry. And therefore, he comes to the therapy because he wants help. But when he starts to work on his anxiety, this resistance of letting go of anxiety comes in between.
Oh,
Now,
I
does
see. Yeah, yeah. So that's a good example. So in that case, we would look for the evidence that the worrying helps, because it sounds like that's what comes in between working on the problem and not, which
Okay.
is the worrying will help. So what's the evidence the worrying helps? And if you have evidence, I'll help you worry more by reinforcing your musts and awfulizing, and then we'll run an experiment and see if that helps.
Okay. Okay. So I think I now I understood what is your take on this whole notion of resistance.
Yeah.
Great. And the last question which I may ask is that what is there is a new notion there, because Freud was basically bashed because there was no evidence for the Freudian psychoanalysis. They could not
Yeah.
find any evidence. What is the evidence for REBT? What is the literature? So one objection against REBT is there is not enough research done on REBT. There is a
Yeah.
research on
Yeah.
CBT, but
Right.
REBT is not backed by research. So how do you answer that question?
Well, that's a very good question. And the answer is largely anecdotal. But as you said, there hasn't been much research on REBT. Albert Ellis, who devised REBT, was a clinician, not a research psychologist, and he wasn't connected with the university where they do research. So there wasn't much research on REBT. So REBT became popular mainly because people found it helped with their problems, and more people and therapists were interested in cognitive behavior therapy and REBT. That's how it became popular. But as you say, there hasn't been much research on REBT. That's correct.
And just just ducktailing on this point of yours where you said that REBT became popular. But of late, it seems that there is a worry among the REBT purists that the CBT and other forms of therapies have taken over the psychology world, in the sense that REBT is not being that popular. It has lost its shin. And other forms of therapy like the CBT by Aaron Beck and ACT by Stephen Hales, things like that are taking over in terms of popularity. So, how do you look at the phenomena? Is it
Yeah,
because
yeah.
of the limitations of REBT or what?
Yeah, I don't think CBT is taking over from REBT because REBT has always been a small movement in therapy.
Mm.
And when Albert Ellis developed REBT, it branched out into other therapies that had the same idea, that it's our thinking that causes our emotions, and they repackaged it. So I think any kind of therapy that is based on that is a great improvement over psychoanalysis, and uh, and I think that REBT is basically a philosophy of life. It's a perspective, a way of looking at things, and people tend not to be that philosophical. So cognitive behavior therapy, as opposed to REBT, is more concrete based. It's not philosophical. It's more just looking at evidence, not seeing the larger picture, which is that there are no musts and shoulds. They don't exist. They're fictions. And I wrote a popular article about the comparison between REBT and CBT, which if you do a Google search, you could easily find it. And the title of the article is 5 Major Differences Between REBT and CBT. And one of the first difference is the philosophical difference, that REBT goes ultimately for unconditional acceptance, unconditionally accepting oneself, unconditionally accepting others, and unconditionally accepting the conditions of one's life. Whereas CBT is not philosophical, it doesn't look at unconditional acceptance at all. Also, another philosophic difference is that REBT doesn't recommend high self-esteem as a solution for low self-esteem, but it throws out the whole concept of self-esteem and says that self-esteem comes from rating your behavior and generalizing that to your total self. So I did well, therefore I'm a good person. That's high self-esteem. Or I did poorly, therefore I'm a bad person. That's a low self-esteem. But REBT says don't rate yourself in terms of your behavior at all. Rate your behavior. It's important to analyze whether you did well or did poorly, because if you did well, then you'd want to continue whatever you did. If you did poorly, then you'd like to try to improve your behavior, but don't overgeneralize to rating your total self. That doesn't help and tends to lead to anxiety and depression in the long term.
Yeah, great. So I would like to now end this podcast with last two questions, which are intertwined, and that is, um, you said that REBT is philosophical and people tend not to be philosophical. So, do you think this as limitation of REBT? One, and you said that REBT is a philosophy of life. So, what does REBT talks about meaning of life? One objection may come against REBT is that REBT, if it is a philosophy of life, it does not give meaning to my life. So, how do you answer these two questions?
Well, in terms of meaning to your life, I do once in a while get a client who's comes with a problem of there's no meaning in their life. So I teach them how to get meaning in their life. And the main way to do it is find a passion, find something that you really love and work toward that. And Albert Ellis used to say somewhat humorously, if you like war, work for war. If you like peace, work for peace. But so find out what you like and try to delve into it and make it a part of your life and make it a passion. So REBT can be used to help with that. And what was the other objection, Niraj?
Yeah, it was regarding, you said that REBT is philosophical and people tend not to be philosophical. So is this
Yeah,
a
right.
limitation of REBT?
Well, it's a limitation of people, but REBT tries to help people extend their boundaries and learn to be more philosophical. But for those who just can't do that at all, REBT still has the cognitive behavior therapy part in it and looking and teaching people to look for evidence for their beliefs in the real world and not necessarily develop a new perspective on life, but practice the empirical method.
Okay, okay. So I think that Ellis called it inelegant solution.
Yeah, right, exactly. An inelegant solution rather than an elegant solution, but still a solution.
Yeah, yeah. Great. I think, Michael, you have answered all the questions with clarity, and I hope these answers will be helpful to people who are practicing REBT or who wants to understand how to navigate through the limitations which they perceive about REBT. So thank you very much. Michael website, I am just going to put in the notes below. So you can take help from him regarding REBT or regarding your therapeutic journey. So thank you very much, Michael. Hope to see you again.
Yeah. Thank you, Niraj. Those have been great questions, and I think you've covered just about all the objections to REBT very thoroughly. So, and that was very interesting. I enjoyed discussing that with you.
Yeah. Thank you. Thank you.